right, this is my physical assessment by Mary Burns. We're going to start with the heart and the neck vessels. So with heart sounds, my current stethoscope, I have a diaphragm. I do not have a bell. But if you did have a stethoscope that had both a diaphragm and a bell, you would listen with both. And so you're going to start at your apical for your heart sounds. And then you're going to create a Z pattern in order to listen to all of your heart sounds. And as far as your heart sounds go, you're going to listen to S1, which is heard best at the apex, and S2 is heard best at the base. And then if you were going to be listening to the mitral murmur, you would have your patient lay down in the left lateral position, and that would be how you would best listen to that. The other thing that you're going to assess with the neck vessels is your carotid arteries. So you're going to palpate gently to feel the carotid arteries, and you always want to make sure that you only assess one side at a time. You don't want to cut off blood flow. And then you also are going to auscultate your carotid arteries, and you're going to listen. And it would be abnormal if you were to hear bruits when you're auscultating the carotid arteries. We're then going to move on to the lungs. So with your patient, you're going to look at them and you're going to assess their respiratory rate, the rhythm in which they're breathing, the depth and the effort. You're going to want to see, are they using any accessory muscles? Are they in a tripod position? Do they appear like they're having trouble breathing? And then as far as palpation goes, you're going to stand at the back of your patient and you're going to have them take a deep breath while you have their hands on your back. And you're going to assess that when they take a deep breath, as the chest cavity expands, that everything is symmetrical. You are then also going to, on the back, you place your hand and you have your patient say 99.
99.
And again.
99.
And again.
99.
And so you'll do that at a total of 5 times on the back, and you're going to feel for the vibrations, which you should hear as the patient says 99. As far as listening to your breath sounds go, you're going to assess the bronchial lung sounds, which are going to be more up towards the top here. And then you have your vesicular lung sounds, which are going to be your typical lung sounds, which are going to be out towards the outside. And with the vesicular lung sounds, you can listen to them both anteriorly on the sides and then posteriorly as well. And then you're going to have your bronchial vesicular, which is going to be your inner lung sounds, but you don't want to palpate, or you don't want to auscultate over the sternum because it'll dampen the sounds. All right.
Excuse me.
And then as far as assessing the abdomen goes, I'm going to have you lay down for this for me. So when you're assessing your patient's abdomen, you're going to want to have them lay down, and you're going to be looking at the symmetry of the abdomen. You're also going to assess for any visual lesions, pulsations of the abdomen. You then want to auscultate your bowel sounds. You always want to listen first, and you're going to listen for your bowel sounds in all 4 quadrants. And then you can also assess for your vascular sounds. So you have your aortic, and then your iliac, and then your renal, that you can listen for the sounds. And then once you're done listening, you're going to want to palpate, and you're going to feel for any masses or to see if your patient has any abdominal pain when you palpate. All right. You can go ahead and sit back up. All right. We're then going to go to our extremities. So both on your upper and lower extremities, you're going to assess the nails, the hair distribution. You're going to look for any edema or any abnormalities to the skin. And then with your upper extremities, you're going to check your capillary refill in the fingers. And then you're also going to assess your pulses. So you have your radial pulse.
Excuse me.
You have your ulnar pulse. And then up here you have your brachial pulses. And you're going to, as you assess each pulse, you're going to score it from 0 to 4, with 2 being normal. So in this case, on this patient, all of our pulses were at 2, which is normal. You're going to do the same thing with your lower extremities. You're going to look for your capillary refill, and you're going to assess the pulses as well. In this case, you have your popliteal pulse, your posterior tibialis, which is down by the ankle, as well as your popliteal, which is up on the top of the foot. Those pulses get rated the exact same way that your upper pulses do. And in this case, her lower extremity pulses are all also +2. We're then going to move into our eyes and our ears, as well as our cranial nerves. So to assess your cranial nerve 2, you do what they call the confrontation test. And for the sake of time now, I'm just going to explain how you would do it. So I would cover the same eye. I would cover my left eye, my patient would cover their right eye. And what you're doing is, assuming that you have normal peripheral vision, you're going to slowly bring your finger in to test to see where you can see and where the patient can see, to see if their peripheral vision is normal. To assess cranial nerves 3, 4, and 6, you're going to have your patient look straight ahead and have them follow your finger from side to side and up and down. If there's no abnormal eye movements or nystagmus when you're completing this, then those nerves are intact. With cranial nerve 5, you're going to have your patient clench their teeth, and then you're going to palpate their jaw in with their jawline to make sure that that muscle is taut. You're then also going to have them clench their teeth, and you're going to try to push down on their chin, and there should be resistance when you're pushing down on their chin. For cranial nerve 7, you're going to have them do several facial movements. So can I have you smile, frown, and then I want you to close your eyes, and I'm going to try to open them, but don't let me. So they keep their eyes closed against resistance. And then can I have you lift your eyebrows, show your teeth, and then puff out your cheeks. And then when you push in and puff their cheeks, the air should be released symmetrically. For cranial nerve 8, you're going to have some hearing. So with this test, you're going to just whisper, and can you hear what I'm saying when I'm whispering? So if the person can hear when you're whispering, it's called the whisper test, and that means that cranial nerve 8 is intact. For cranial nerve 9 and 10, you would usually have a tongue depressor, which I don't have with me now, but what you would do is have the patient open their mouth, and you would depress their tongue, and then you would have them say ah, and you would look for the movement of the uvula while you're having them do that. For cranial nerve 11, you're going to have them move their head from side to side, but you're going to have them do it with resistance. So what I want you to do is turn your head against my hand and then push against it. Okay? And then do the same thing on this side. So you want to see that they're able to push against you. And then you're going to have them do the same thing with their shoulders. So can I have you just lift up your shoulders? So then they should be putting pressure on your hands. And also at this time, you can assess your head for shape, size, your hair. You can also palpate for any tenderness in the area of the head, palpate for any lesions. Along with the jaw test, you can check their range of motion with their jaw, so have them open their mouth and move side to side. So if you can open your jaw and then move it side to side. You're also going to be able to, at this time, check tracheal position to see that your trachea is midline. You can inspect the lips, their oral mucosa, their tongue, their gums, their teeth, to make sure, in this case, her mucosa is pink, moist. She does not have any missing teeth. You can also look at the tongue, and along with cranial nerve 12, you can have your patient stick out their tongue, and you can inspect their tongue to make sure that it is midline. And then also to assess cranial nerve 12, you want to have them say, can you say light, tight, and dynamite?
Light, tight, and dynamite.
So that way you can see how the word sounds are to make sure that everything is symmetrical. And then you also want to assess the nose to make sure that there's no crepitus. as well as the sinuses. You have the frontal sinuses here, and then the maxillary sinuses down here. You want to palpate them to see if there's any pressure or discomfort. And you also want to check that the patient's nose is patent on both sides. You also want to palpate the ears for any tenderness. Note any drainage or tenderness in the area of the ears. You also can assess your eyes. So you're going to look at the external tract structures, looking for any type of drainage, any redness. And then you're also going to assess the pupils. So if I could have you take your glasses off. So you're going to have your patient look straight ahead and shine a light in. And what you're looking for is that the pupils react to the light. And you're also going to look that they react equally and that they constrict at the same time and have equal accommodation. All right. And then once you've assessed all your cranial nerves, you're also going to look at your deep tendon reflexes. So you have your bicep reflex. So you're going to hold your patient's hand here. And if you had a reflex mallet, you actually tap it to your thumb to see that there is a reaction. And then with your tricep, you're going to have the patient relax their arm and kind of hang it like it's dead. And then you would take your mallet and you would tap it at the tricep to see that there was a reaction. You're also going to do your lower extremities as well. So with your plantar reflex, you would take your hard object or your fingers and rub it along the bottom of the foot. And in a normal adult, the toes would curl in. An abnormal result would be if the toes fan out. And then you also could do that with the Achilles tendon. You have them rotate their hip outwards, and then you would tap the area of the Achilles tendon to ensure that it responds properly. Final assessment is the musculoskeletal assessment. So you're going to look at the arms and you're going to inspect them for any pain, any deformities, and any crepitus. So when you go to move a joint, if there's a crackling sound, that would be crepitus. You're going to look at the joints and you're going to assess range of motion as well as muscle strength. So in the case of the elbow, you're going to see that they can completely flex and extend. And then you're going to see that they can have muscle strength against resistance. So I want you to try to pull your arm towards you, and I'm going to pull away. So you want to see that there's muscle resistance there. And then you're going to do the same thing with your lower extremities. You're going to look for any pain, deformities, any crepitus, and then you'll do the same. So for the knee, you would make sure that it could flex and extend. And then as you push against it and the patient's able to extend it even though you're giving resistance. And then last, you're going to have your patient stand. And you would assess their gait. So just take a few steps that way and then a few steps back towards me, to make sure that they have a balanced gait and that they're not off balance. Another thing that you'll do is called the Romberg test. So you'll have your patient stand up with your feet together, hands at your side, and then I want you to just close your eyes. If your patient's able to remain straight, the Romberg test is a test for balance, and in this case, her balance is intact. And then last but not least, you're going to assess your spine. So if I can have you turn it around. You'll look at your patient's back to see if their spine is in line, that you don't have any curvature, and then you're going to check your range of motion for the spine. Turn back around. And for range of the motion with the spine, you can have the patient bend over and then turn from side to side. You can stand back up and then also bend from side to side, and that gives a full range of motion for the spine. And I believe that concludes our assessment at this time. I thank you for your time.